My name is Kaushik Gune. I lead Huma's US business. Huma has been, in the digital health space for, about 12 years now, since 2011, back when digital health was just a gimmick. And the founder had this big vision of, how can we move healthcare interactions that typically happen in clinic or in hospital over the phone, over the smartphone technology that everybody has in the home, and really improve, the patient experience. We at Huma aspire to bring, delightness into patient experience, which often, being in healthcare, you don't think of, achieving delightfulness in patient experience, but that's the bar that we at Huma want to achieve. And really our journey, started very humble in rare disease space, where pharma companies, providers were really interested in capturing anything and everything they want so that they could understand the disease, they could understand the patient really well 10, 12 years ago. And that actually served Huma really well, because when you do one rare disease and then you do another project in another rare disease, you have to rethink about your technology in a completely different way. And so by the time we had done about 6, 7 rare diseases, we had gone through so many permutations and combination that actually, built our technology. It grew the muscle of how can your technology be adaptable to not just, a blanket technology, but each individual patients. And today what we call as is we are one of the, only company out there that has truly a modular technology that can not only scale very fast. We've had national deployments in UK, we've had national deployments in Germany, but more importantly, we do that without sacrificing customization. So we've achieved that through the robustness and the flexibility of our platform. AI is really fascinating, right? Like anything about AI, even on the positive side or on the concerning side, right? It's very, very positive. Where we are excited about AI is we see, applications of AI across our platforms, right? If you think about, a respiratory patient going through, a COPD exasperation, can we, based on the patient's medication history, based on the environmental factors, can we, identify high risk or, potential of an exasperation and provide a window of opportunity to clinicians to intervene before the event actually happens? I think something like that is super powerful, right? From a challenging perspective, I think we need to work very closely with the regulators to make sure that we are taking all the right steps and bring the regulators along this journey. This is not a journey where a tech player can just innovate by themselves. I think we all as a healthcare community need to innovate together. Whereby the regulators are guiding to make sure safety, efficacy, barriers are met. But at the same time, regulators are also fast enough to allow this innovation and potential to be realized. When I speak with a lot of the providers today, whether it's digital health, whether that it comes from AI, I don't think there is a massive distinction. But what they are asking, the problems that they are highlighting and looking at us to solve for is things like, if only I had known X about this patient, help me identify those patients who need help, today, versus, me finding out that they went to a ER visit or had a hospitalization. I think that's very, very valuable. And that is why, screening tools, predictive tools, whether they are, via digital health, whether they are, powered by AI, are going to see, a lot of adoption, because our provider, customers and community are really hungry and really begging for that. Right? So that's one area. The second area where they are asking for help is they are massively, resource strained. Our entire healthcare community. You talk about surgeons, doctors, nurses, PAs. So any tools that can take away work from them, work that doesn't require, clinical, judgment, doesn't require, one-to-one patient relationship. They are happy to, because at the end of the day, our providers want to spend more time with sick patient, build that trust, provide that personal touch. So the more we can do with technology, things that are outside of the scope, the provider community are hungry for that. The final thing I'll mention, which we didn't talk about, is the whole focus that we have on our clinical trial and research space. We talked a lot about digital health and AI in the practice space, right, or care delivery space as we think about it. But research is a big part of our business. UK, recently, published a big report of how UK is, the government of UK published this report, and how UK is lagging in funding innovation in clinical trial, as well as participation in clinical trial. And they talk about how this will impact not only UK's position, but also, the future medicines that come out, and how the UK's citizens will or will not benefit because of lack of participation in that. And they talk about how Huma is driving innovation in this field. There's a big piece around that, and I think that's a charge we are taking of driving innovation in the research, because whatever you do in research kind of slowly trickles down a few years later in the main care delivery side. So the two big examples on the research that the report talks about is how we worked with AstraZeneca to conduct their COVID vaccine trial, where it was a global trial. Patients from across the continents were able to participate and report their data through Huma technology without ever visiting a trial site. No. And we are talking about hundreds and 100,000 patients globally. We also in collaboration with them conducted a real world evidence generation study on predicting kidney disease. And again, using innovation and our platform, we were able to recruit about 7,000 patients in less than a month. So these are the types of also innovations that we need to start thinking about bringing to the market in the research world. Understand research is a lot more structured, a lot more ingrained, but we have to push the boundaries to make sure that there's health equity not only in the care delivery side, but also on the research side, allowing people who are far located from the key academic and research centers also to participate in the research.